This is actually Portland Wellness Care, and we're going to go through 3 exercises to strengthen the glute medius muscle, which is one of your pelvic stabilizers. It helps a lot with just general leg movement, making sure as you walk your hips are staying stable, and that takes a lot of pressure out of the low back and also helps to cue in a little more abdominal engagement. So it's a really important muscle group and area to focus on and to work on. One of the classic rehab exercises for this muscle is called the McGill side plank or side bridge. So you'll do that with your elbow on the ground, hand kind of in line with your shoulder, and elbow right under your shoulder as well. Knees are going to be about 45 degrees in front, with the heels roughly in line with the hips and the shoulders. From here, you can have the top hand on your hip if you like to feel. Otherwise, you can just make sure you're engaging through your core. Pressing down through this outside leg, the knees and the feet. You're going to just extend your hips forward and up at the top. So it's going to look something like this. Hips come forward, and then as you lower, hips come back. Forward, squeezing to the sides of the hips, and then back. The main thing to make sure is that there's no rotation through your torso as you're doing this. And you also want to make sure you're not bending too much in your lower back as you press your hips forward. So maintaining that good core control, hinging from the hips to come down with a neutral spine, and then hinging from the hips to press back up with a neutral spine. So this is one option. It's good for stabilizing and strengthening that glute med, like I said, which is sort of the back pocket area muscle, but it'll also help build some shoulder stability. So it's a really good exercise for combining upper and lower body stability. Another option for strengthening your glute medius is the classic glute clamshell. So you can do this either propped up on the forearm like this, or another option is just lying all the way down on one side. You can use your arm or just a regular pillow for a little support there, and have this top hand either in front of your chest to make sure you're not rolling around, or you can also use it on your hip to feel where your hip is in space. The main goal here is to maintain that abdominal stability so your back doesn't move, and you want to make sure you're not rolling around on the floor. So sometimes I like to perform this against a wall to prevent me from being able to roll backwards. Anyway, from here, keeping the lower leg pressing down, all you'll do is lift that top knee up and open your hips out. So this is one option for how to perform this. The feet can be together on the ground. Another variation is feet squeezing together, lifting off the ground just a few inches and performing that same clamshell. Once again, the point is to keep that whole core structure really still and stable, and just the leg is moving. So you want to make sure you don't feel like you're rolling backwards and losing your balance as you perform this motion. You want to move from this muscle here. So you can use those fingers to feel the muscle and make sure it's working while you're doing it. A third option to target this muscle, also from the same position, is straightening out the top leg, turning the toes slightly down towards the ground, and just lifting the legs straight up. From here, you can go straight up and down, or if you want to get a little more complex, you can start to spell the alphabet or even your name with your foot in the air. Just performing these small controlled movements with your leg in the air can be a really good way of activating specifically through this back pocket region and turning on those stabilizers in your pelvis. While you're moving your leg, again, focus on keeping your hips pretty still, this whole structure of your pelvis through your core and your spine. You're just moving the leg. That should do it. Hopefully this helps you with your glute stability.